How to complete the Plans and Benefits template. Issuers seeking to offer qualified health plans or QHPs, including standalone dental plans or SADPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Among these templates is the Plans and Benefits template. The Plans and Benefits template collects health insurance plan information, including plan identifiers, plan attributes, geographic coverage, benefit coverage, and cost-sharing information. Before filling out the Plans and Benefits template, you'll need to complete the Network ID template, the Service Area template, and the Prescription Drug template. You'll also need to download and save the Plans and Benefits add-in file and the Standardized Options add-in file to your computer in the same location as the Plans and Benefits template. The Plans and Benefits add-in file uses state-specific benchmark information to auto-populate the template based on information you've entered. The Standardized Options add-in file helps users populate the cost-sharing information for plans that are standardized options. Opening these files along with the Plans and Benefits template adds additional tabs to the ribbon across the top of the template. Additionally, you'll need to download and save the Actuarial Value Calculator to your computer. The AV Calculator, or AVC, helps determine levels of coverage by calculating the actuarial value for all standard non-catastrophic medical plans, all Silver Plan Cost-Sharing Reduction, or CSR variations, and all limited cost-sharing plans. The AVC will be used before validating your template. To download the Plans and Benefits template, add-in files, AVC, and applicable instructions, visit the Plans and Benefits webpage of the QHP certification website. This webpage contains more information about the Plans and Benefits section of the QHP application, including tips and additional resources. Before filling out the Plans and Benefits template, download and read the instructions from the Application Resources section. Once you're ready to complete the Plans and Benefits template, download the template, add-in files, and AVC from the Application Resources section. Save them to the same folder on your computer. Open the template and add-in files, and enable macros in the template. The Plans and Benefits template is divided into two portions, the Benefits Package Worksheet and the Cost Share Variances Worksheet. A Cost Share Variances Worksheet will be created for each Benefits Package Worksheet that you complete. The Benefits Package Worksheet itself is divided into two sections. The top section collects basic information about the issuer and type of plans that will be offered, while the bottom section collects more information on benefits. Each Benefits Package Worksheet can collect data for up to 50 plans. If you need to provide information for more than 50 plans, create a new Benefits Package Worksheet with an identical benefits package structure. When filling out templates in the QHP application, start in the top left corner and fill out fields moving down and to the right until all required fields are completed. Now let's walk through filling out the Plans and Benefits template with sample data. Before you begin, look through the data elements required to ensure you have the necessary plan information to successfully complete this template. To start, navigate to the Plans and Benefits tab in the ribbon across the top and import the Service Area, Network ID, and Prescription Drug templates by selecting the appropriate buttons and following the prompts in the dialog boxes. Note that you will not import the Prescription Drug template into the Plans and Benefits template for standalone dental plans, or SADPs. Once you've imported the necessary templates, enter the 5-digit HIOS issuer ID you received when you registered in the Health Insurance Oversight System, or HIOS, and the state where the applicable plans will be offered. Next, use the drop-down menu to select the market coverage type for the products you're offering. You'll choose either individual or shop. SHOP stands for Small Business Health Options Program and is designated for products offered in the small group market. Issuers offering both individual and small group products will need to fill out separate Plans and Benefits templates for each market. If this applies to you, navigate to the Plans and Benefits tab in the ribbon and select New Plans and Benefits template. Follow the prompts to create the additional template. The next data element asks you to determine whether this template is for dental-only plans. If you select yes, some data elements will be grayed out. These do not apply to SADPs. You will need separate templates if you offer both QHPs and SADPs. Required fields are marked with an asterisk. Moving to the Plan Identifiers section, enter the 14-character alphanumeric HIOS plan ID that identifies the plan associated with the information you'll provide in this row. Plan IDs should be unique for each plan, including across market types. Next, enter the plan marketing name for the standard plan level. This name will be displayed to the consumer. Then enter the 10-character HIOS product ID associated with each proposed plan you wish to offer on the exchange. Select the network ID, service area ID, and formulary ID associated to this plan. In the Plan Attributes section, use the drop-down menu to select whether this plan is new for the current plan year or existed in the previous plan year's QHP application submission. Issuers should also select New if the plan was offered last year, but the plan design exceeds the uniform modification of coverage standards. All existing plans should use the same HIOS plan ID that was used for the previous plan year. Next, select the plan type. This must be consistent with your state form filing submissions. Then select the level of coverage, identifying the metal level of the plan based on its actuarial value, or AV. The next field says to select the design type from the drop-down menu. If the plan is not following a standardized option, is an SADP, or is a shop plan, select Not Applicable. If the plan is following a standardized option, select the appropriate design type for the state the plan will be offered in. The first set of standardized options applies to all FFE and SBEFP issuers, excluding those in Delaware and Louisiana. The second set of standardized options applies to issuers in Delaware and Louisiana. The third set of standardized options applies to issuers in Oregon. Note that this designation is selected at the plan level, but must be applied to all associated plan variations. For more information on standardized plan design and populating plans cost sharing using the standardized plan add-in file, refer to the QHP application instructions on the QHP certification website. The template then asks if this plan design is unique, meaning the plan would not use the standard AV calculator. Refer to the AV calculator or AVC section of the QHP application instructions to determine if a plan is truly unique. Select Yes if the unique plan design features cause the use of the AVC to yield an AV result that materially differs from that of the other approved methods. If you select Yes for this reason, upload the unique plan design supporting documentation and justification. Next, indicate if the plan will be offered on the exchange, off the exchange, or both. Plans offered both on and off exchange must have the same premium, provider network, cost-sharing structure, service area, and benefits. Selecting this option creates two separate plan variations in the Cost Share Variances worksheet. Indicate in the next column whether the plan requires the issuer to be notified by a doctor before pregnancy benefits are covered. The next element, Plan Level Exclusions, is an optional field that issuers can use to enter any exclusions that may apply to the plan. The following field, Limited Cost Sharing Plan Variation Estimated Advanced Payment, is also optional. In the next data element, select whether this plan offers composite rating. Next, complete the child-only offering field by indicating whether the plan is offered at a child-only rate or has a corresponding child-only plan. Note that selecting allows adult only does not mean that only adults can enroll in the plan. Rather, this plan requires an adult to be the primary subscriber. An adult-only plan requires a corresponding child-only plan ID. Note that FF Shop does not accommodate child-only plans. If you select Allows Adult Only and the coverage level is not catastrophic, the next data element is required. Enter the 14-character plan ID that corresponds to the child-only plan. If the coverage level of the plan is catastrophic, the child-only offering field auto-populates as Allows Adult and Child Only. Catastrophic plans are available to any enrollment group of consumers under the age of 30. In the next column, indicate whether the plan offers a wellness program designed to prevent or reduce tobacco use. The Disease Management Programs Offered field is optional, available for you to indicate whether the plan offers programs for one or more of the following: asthma, heart disease, depression, diabetes, high blood pressure and high cholesterol, low back pain, pain management, pregnancy, or weight loss programs. In the next column, enter the percentage of the total premium that is associated with the Essential Health Benefit or EHB services in each plan, including administrative expenses and associated profits. This data element is required for all plans on the individual market other than catastrophic plans. The EHB percent of total premium is used to calculate advanced premium tax credits. The next section is only required for SADPs. In the first data element, enter the percentage of the portion of monthly premium allocable to the pediatric dental EHB. In the next column, select Guaranteed if you wish to charge the premium shown to the consumers on healthcare.gov, or Estimated if you wish to have the enrollee contact you to determine the final rate. The next section, titled Plan Dates, collects information regarding the effective and expiration dates for each plan. In the first element, enter the effective date for this plan using the format shown on the screen. The effective date must be January 1st of the plan year for all plans that will be offered through the Federally Facilitated Exchange, or FF Shop. Using the same format, complete the plan expiration date field. This date must be December 31st of the plan year for the individual market. In the geographic coverage section, first complete the out-of-country coverage field to indicate whether the plan will cover care obtained outside of the country. If you select yes, enter a short description of the care that is covered in the next field. Next, indicate whether the plan covers care obtained outside of the service area. Again, if you select yes, enter a brief description of the care that is covered in the next field. The final data element in this section asks you to indicate whether a national network is available for this plan. Finish filling in information for additional plan IDs you want to add to this template. Now let's walk through the benefit information section of the benefits package worksheet. All of the data elements in the benefit information section must be completed for all benefits offered, which are shown on the left side. Navigate to the Plans and Benefits tab in the ribbon and click Refresh EHB Data. If the benefits package has multi-state plans using an alternate benchmark, click Yes in the dialog box that displays. Otherwise, click No. The data in the benefit information section auto-populates based on the state. Review that the auto-populated information is accurate according to your state's benchmark plan. Refer to the SSIO website to determine if a benefit needs to be covered for your state. To add additional benefits, select Add Benefit from the Plans and Benefits tab and follow the dialog box's prompts. To delete a benefit, navigate to column D, select Not Covered, and click the Refresh EHB Data button. This removes any added benefit that is not covered. Note that if you select Refresh EHB Data, any data that has been manually entered or changed in other fields in this section will also be removed, and you may need to re-input data you had already entered. The first data element in the General Information section asks if the benefit is covered by the plan. For benefits that are identified as an EHB, the field auto-populates as covered. If you change this to not covered, you must substitute another benefit in its place, and provide the EHB supporting documentation and justification. If you entered covered, the quantitative limit on service field is required and is auto-populated based on the designated EHBs. Some fields are left blank. If you change this field, you must provide an EHB variance reason and associated supporting documents. For any benefit not identified as an EHB, indicate whether the benefit has quantitative limits. If yes was entered on the previous element, complete the limit quantity and limit unit fields to show the quantitative limits placed on this benefit. A dialog box will appear, prompting users to select the quantitative limit units per interval. In the exclusions field, enter any benefit level exclusions for particular services for diagnoses that are covered under some circumstances, but not others. Next, enter any benefit explanations, which may include additional quantitative limits, links to additional plan documents, child-specific maximum out-of-pocket or deductible limits, or alternate cost-sharing structures. If changes have been made in the previous 4 columns, select the EHB variance reason. In the out-of-pocket exceptions section, indicate whether each benefit is excluded from the maximum out-of-pocket, or MOOP. All plans in a benefits package must have the same MOOP structure that exclude the same benefits from the MOOP. If you have plans that offer a different MOOP structure, create a new benefits package from the Plans and Benefits tab in the ribbon. If your plans do not offer different MOOP structures, then indicate if the benefit is excluded from in-network MOOP. The final data element in the benefits package worksheet is excluded from out-of-network MOOP. In this field, similar to the last data element, indicate whether this benefit is excluded from the out-of-network MOOP. We've completed entering data for the benefits package worksheet. Now let's move to creating and completing the cost share variances worksheet. As mentioned earlier, each benefits package worksheet needs to be accompanied by a cost share variances worksheet. To create a cost share variances worksheet, navigate to the Plans and Benefits tab in the ribbon across the top of the template and select Create Cost Share Variances. Read the dialog box's questions, select OK, and read the reminder that displays. Select OK again. The template will then ask if you have deductible subgroups, which are used to identify benefits or groups of benefits that have their own deductibles. These deductibles are not outside of maximums allowed and still contribute to the overall MOOP limits. If you select Yes, you'll be asked to enter the number of subgroups and uniquely name each one. Once you've completed the deductible subgroup prompts, the Cost Share Variances worksheet will be created based on the data entered in the Benefits Package worksheet. Each Benefits Package Cost Share Variances worksheet pair will be labeled with the same number. The Cost Share Variances worksheet will contain the necessary plan variations for each standard plan entered in the Benefits Package worksheet. Review the QHP application instructions for additional details on plan variations. If you indicated on the Benefits Package tab that a plan is following a standardized plan option and indicated a design type, navigate to the Standardized Options tab in the ribbon across the top of the template and select Populate Standardized Options data. A pop-up will remind you to confirm every plan that follows a standardized plan option is correctly indicated in the Design Type column of the Benefits Package tab. If you select OK, the template will populate all applicable fields on the Cost Share Variances worksheet, depending on the metal level of the standardized option. The first 4 fields in the Plan Cost Sharing Attributes section have been auto-populated from the Benefits Package worksheet. Note that the same plan variant marketing name appears for all variants of a standard plan. Feel free to change this field if you want unique marketing names to display to consumers. The level of coverage and the CSR variation type fields cannot be edited. Note that the HIOS Plan ID field contains plan IDs with a dash and 2 digits following the standard plan IDs. The CSR variation type field gives a description of the cost-sharing structure for each plan variant related to the 2-digit variant. For example, all -02 plan variants are the zero cost-sharing plan variants. To learn more about the plan variants, refer to the QHP application instructions. If you labeled a plan as having a unique plan design, the Issuer Actuarial Value field is required. Enter the Issuer Calculated AV here. For all non-unique QHP plan designs, the next data element, the AV Calculator Output Number, is required. Complete this field after all other cost-sharing information has been filled out. For SCDPs, issuers have the option to input a value in the Issuer Actuarial Value field of the template. While this field is optional, if the issuer chooses to enter the AV level of coverage into the template, the SCDP's AV must fall within the previous requirements of the high or low AV coverage. The next 2 columns only display for QHPs. In the next column, indicate whether the medical and drug deductibles are integrated for this plan. The deductible is integrated when both medical and drug costs will accrue towards a single deductible. The deductible is separate when medical and drug costs accrue towards their own respective deductibles. Your selection for the standard plan will populate for all its plan variations, since all plan variations are required to have the same plan structure. Similarly, in the next field, indicate whether the medical and drug maximum out-of-pocket values are integrated. In the next field, indicate whether a referral is required to see a specialist. If you select yes, enter the types of specialists that require a referral in the next column. In the Multiple In-Network Tiers field, select whether this plan includes multiple tiers in its network, thereby applying different levels of in-network cost sharing depending on the tier of the provider or facility. This data is used for the AV calculation for non-unique plan designs. The next 2 columns allow you to specify the percentage of the anticipated cost of claims utilized within each tier. If you do not have multiple in-network tiers, these fields auto-populate. If you do have multiple in-network tiers, enter the value for the first tier utilization, and the second tier utilization field will auto-populate. The fields in the SBC scenario section are required for medical plans and can be accessed through healthcare.gov's Plan Compare. Cost-sharing information for each SBC scenario is required for the data elements within each subsection: having a baby, having diabetes, and treatment of a simple fracture. The next several sections collect MOOP and deductible information for each plan. There are subsection headers including In-Network, In-Network Tier 2, Out-of-Network, and Combined In-Out-of-Network. Beneath each header are data elements for both individual and family plans. Depending on whether the medical and drug deductibles and MOOP values are integrated, some of the fields will be grayed out and cannot be edited. For this example, the test data shows a plan that has an integrated medical and drug MOOP. Therefore, the sections maximum out-of-pocket for medical EHB benefits and maximum out-of-pocket for drug EHB benefits are grayed out and cannot be edited. Under the maximum out-of-pocket for medical and drug EHB benefits total section, issuers can enter separate in-network and out-of-network MOOP limits, or enter a combined MOOP limit that accounts for both in- and out-of-network costs. In this example, we will enter separate MOOP values for in- and out-of-network. In the In-Network Individual MOOP, select X dollars from the drop-down and enter the individual MOOP limit. This number cannot exceed the annual limitation on cost sharing. Note that the 3 silver plan variations have different MOOP limitations than those set for a standard plan. Next, enter the in-network family values in the dialog box that displays, noting that the per-person value applies to a single person in a family. The per-group value applies to the family as a unit.
Continue completing the in-network Tier 2 and out-of-network fields in the same way you completed the in-network fields. Because this example does not use a combined MOOP, select Not Applicable for the applicable fields. The next two sections, called the Medical EHB Deductible and Drug EHB Deductible, are similar to the Medical EHB MOOP and Drug EHB MOOP sections. The values here should be completed if the medical and drug deductibles are not integrated, as in this example. These fields are similar to the fields in the MOOP section, with the addition of the default coinsurance field. This field is used to calculate the AV when running the AV calculator. Complete these fields similar to how you completed the previous section. The data elements in the combined medical and drug EHB deductible section should be completed if the medical and drug deductibles are integrated. Since this example does not have an integrated deductible, this section is not editable. Next, complete the Other Deductible section if you indicated you have deductible subgroups. The HSA/HRA detail section collects information pertaining to health savings accounts or health reimbursement arrangements. In the first column, indicate whether the plan meets all the requirements to be a health savings account or HSA. Then, for small group plans, fill in the HSA/HRA employer contribution to indicate whether an employer contributes to a health reimbursement arrangement. If you selected Yes, enter the whole dollar amount the employer contributes in the next column. The AV Calculator Additional Benefit Design section is used for inputs for the AVC and is not required to complete the worksheet. The first data element, Maximum Coinsurance for Specialty Drugs, collects the maximum coinsurance allowed for specialty prescription drugs. In the next column, enter the maximum number of days allowed for charging an inpatient copay. Then in the next field, enter the maximum number of visits that a visit is fully covered before the primary care cost sharing begins. Finally, enter the maximum number of copay visits that can occur before the visit becomes subject to the deductible and/or coinsurance. The rest of the worksheet collects cost-sharing information for covered benefits. A section has been created for each benefit that was labeled Covered on the Benefits Package worksheet. Each benefit has two sections, copay and coinsurance. Within each section, enter cost-sharing for in-network Tier 1, in-network Tier 2 if you have multiple tiers, and out-of-network. For all copay fields, there is a drop-down with 6 cost-sharing options. Please refer to the QHP application instructions for more details on each cost-sharing structure. Note that the Not Applicable option should be used in cases where you intend to charge only a copay or only a coinsurance for in-network coverage. For this example, we'll complete the cost-sharing section for primary care. We've decided to designate the in-network copay at $30 with the deductible. With a copay with deductible, a consumer first pays the copay, and any net remaining allowed charges accrue to the deductible. From the drop-down under In-Network Tier 1, select the X dollars copay with deductible and enter 30. Then select Not Applicable for the coinsurance value. If we had indicated there were multiple tiers, Tier 2 might be a network of more expensive providers, so if we want to charge a higher copay but use the same structure, we would select the X dollars copay with deductible and enter a value of 40. Then we would select a coinsurance of Not Applicable. In this example, there will be no out-of-network coverage. To represent this, select a copay of Not Applicable, and for the coinsurance, select X% and enter 100. This indicates the consumer will pay 100% of the service. Note that you should not indicate that both the copay and coinsurance are not applicable for Tier 1 or out-of-network cost sharing. However, it's appropriate for both the copay and coinsurance to be labeled as not applicable for Tier 2 if the specific benefit does not have 2 tiers of cost sharing. Continue filling out the benefit cost sharing sections until complete. Then calculate the actuarial value for your plans by returning to the AV Calculator Output Number column. To do this, ensure you have saved the AV Calculator to your computer and select Check AV Calc in the Plans and Benefits tab in the ribbon across the top of your template. Follow the prompts to open your saved AV Calculator and determine whether you want to save screenshots of the AVC calculations. The AV Calculator Output Number column will populate with the values determined by the AVC. Note that if you make any changes to your cost sharing after running the AVC, you'll be required to run it again before you can validate the template. Running the AVC will also run validation checks for your template. Any data issues in your template that need to be resolved will be displayed. In this case, we have 5 data errors. The majority are related to the AVC calculations. Make the necessary corrections to the template and run the AVC again. Continue to add benefits package and cost share variances worksheets until all your data has been entered. Now let's validate and finalize the template. Once you have completed the template, click the Validate button at the top of the worksheet. Any data issues in your template that need to be resolved will be displayed. Correct these and click the Validate button again. Continue this process until all errors have been resolved. Once the template is valid, click the Finalize button to create an XML that will be automatically saved in the same folder as the template. The XML extract is the file you will submit as part of your QHP application. If you have questions regarding your QHP application, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.